Hi, this is Travis Lindsay. I'm here today at the Tyler Internal Medical Clinic with Cody. And Cody is a nurse with Dr. Bradley, Dr. Dale Bradley, who has been one of our big proponents of Max products over about the last, I guess, year and a half. How long have you been working with Dr. Bradley?
I've been with Dr. Bradley for 2 years now.
Okay,
Been involved with the Max for right a year and a half.
okay. And basically, as a medical professional, what gives you the confidence to recommend Max products to the patients?
Well, that's an easy question. Absolutely, it's got to be the results that we've seen from the patients that we've recommended it to. The results speak for themselves, so that's all it takes right
Okay.
there. So,
And just kind of in a real quick way, how does the process work in terms of you recommending? Does Dr. Bradley recommend it? Do you help them out with that, or do you recommend it? How does that work?
well, in the beginning when we first heard about this, we were kind of skeptical, bringing something new into a medical practice, but it started out Dr. Bradley just would talk to him about it, and he tried it on a few people, and they had some good response. He took it himself, tried it with his family. They had some good response. Okay, so we just stepped it up a little bit, recommended it to a few more people. You know, we have all these great response, so we started advertising it a little bit in the rooms, putting poster boards up, information pamphlets, things like that
Okay.
up in the room. Then the patients would come in and they would see it. Well, I'm the first person they see as the nurse, checking them in, getting the vital signs. Well, they start asking me about it, and so I'll talk to them a little about it, give them a little information about it. Then Dr. Bradley goes in and goes over it with them in detail, things he's seen in other patients, things that he's seen to help them with, and it just kind of goes from there. But after that, as Dr. Bradley, being as time restricted as he is, he can't really stay in there and help them get started with it. So he just does kind of the medical, give them a lot of knowledge about the product, what it does, and what he's seen. And then I kind of come in and, fill in the rest and help them get started on it, get them signed up and all that good stuff. So,
Okay.
yeah, that's pretty much how it works now.
Okay.
So,
Very good, and I'm sure that's probably progressed in time. Have you recommended in your practice? And well, I guess I can say both ways. In your practice or outside, just with friends and family,
oh,
have
yeah.
you recommended a nutritional product in the past?
Well, not so much nutritional products. I mean, because, there's always multivitamins and stuff out there, but, none of that stuff's really approved by the FDA, and you never really know what to recommend until you, like, actually see stuff.
Correct.
But yeah, I mean, from what I've seen on this, I've recommended it to my family. I'm in the military. I'm in the reserves now. Matter of fact, I drilled this past weekend, and I talked to a few people about it. But yeah, you know, um, as you know, military people were all about trying to work out
Sure.
and stay healthy. We got to in that field. But yeah, I recommend it to military people, and they've taken it. And I can definitely say, as well as myself, I've heard from a few other military buddies that, it definitely helps our recovery time when we go to work out. As far as, we try to push ourselves, and then the next day, we're not as sore. Our muscles don't ache as much. We're not feeling all worn out from the day before's, activity. So
Correct.
that's a big plus in itself right there. So I know it's doing something for our stamina and energy. So,
Correct.
and I'm young, so I'm not,
How old are you?
normally, I'm 24 years old.
Are you okay?
So, being able to work out every day, and still feel good instead of 3 times a week and be tired every day in between, that's pretty impressive right there.
Absolutely. Well, we see that with well, athletes from professional down to weekend warriors. So
Oh yeah.
I imagine that's awesome to help in the military in that capacity. Um, and I guess from a patient working with the patients, as you've recommended the products too, either GXL or Max One, what would be in terms of disease symptoms? What would be the most impactful thing that you have seen that just kind of jumps out at you in terms of a benefit that you've seen that, in your opinion, or in Dr. Bradley's opinion, Max products really helped with?
Well, I mean, everybody I'm sure is hitting on fatigue. That's one of the main things that speaks for itself. These patients just come in tired, worn out. They work all day, every day. They've worked all their life. They're tired. They're worn out. And this, I mean, I gotta say, I've seen it pick them up. You know, they're getting where they want to do things when they get off work instead of just go home and go to sleep on the weekends. You know, they got more time to spend with their families and doing things they love to do. You know, I've seen it help out in a lot of other medical aspects. You know, I don't know if you really want me to hit on those issues.
No, feel free. I mean,
okay, things like, you know, diabetes and stuff like that. I've seen it help out, you know, people's sugars and their blood pressure. We've been able to cut, you know, patients down from their blood pressure medications.
okay.
You know, and they're loving that. So, you know, they're getting on this nutritional supplement. It's helping them to save money and, you know, cutting off their medications that they were once taking, and
That's a good point.
you know, taking less medication. You know, patients are loving that. You know, I've seen things, you know, from like certain like little types of skin cancers and skin lesions that, you know, not curing it, but you know, it's reducing things that normally there's not really a lot else they could do.
Correct.
You know, so, you know, these people that are taking this stuff, they're loving it and they're just not believing it, and they're telling their friends and family about it. And we got people that we don't even know that are not even patients here calling us up, hey, you know, tell me a little bit about that stuff you recommended to so and so, because, you know, they're telling me this and I don't believe it. I want to try it.
Yeah.
You know, and it just goes on and on from there. You know,
Okay.
so I'm pretty impressed with this stuff. You know, I gotta say.
Well, and that's awesome. And I guess, you know, obviously, and you've touched on this, but in your opinion, you know, do you think the product is changing the quality of lives or life for a lot of your patients?
Oh, absolutely. You know, because you take somebody that's worked all their lives, you know, they come home and they're tired and don't want to spend time with their family. You know, that means the world to their families, them. You know, they're feeling better, able to do more. You know, saving money in other aspects. You know, all that speaks for itself.
Well, without a doubt. And, you know, the fatigue issue you mentioned, is the product working as sugar and caffeine would on the adrenals, or is it a different type of energy that's created?
Oh, it's totally different. You know, you see these people that take energy drinks all day, and you know, they're consuming sugar and caffeine that's messing with their heart rate. You know, it's just real bad effects on the body. You know, people shouldn't take these energy drinks like this, but with the Max, it's totally different. It's helping their body to produce the ATP and glutathione levels in their body, you know, that's giving you the better energy. It's like
Correct.
It's like the greatest multivitamin you can get. You know, it's better than anything over the counter you can get. It's just making people feel amazing. And they do have another energy drink in itself that's not sugar and caffeine that I wish people that take these sugar and caffeine drinks would start, you know, taking the Max ATP. You know, I've tried it myself, you know, on a workout, and it just made me feel good all day long.
Yeah, I have too, and that is absolutely the
You know, I
case.
just felt like I left the weight room. I wanted to go right back and push out a few more, you know. So
Yeah, the stamina is definitely there.
and I didn't feel no drop off, you know, no sugar rush. My heart wasn't pounding in my chest. You know, that's great. I wish a lot of other people would stop with those energy drinks and try this stuff. So
Yeah, well, and that's
it's a lot safer for them. So.
absolutely, absolutely. Do you have any, or I guess let me ask it this way: is there any reactions with medications? Is anybody in particular that you would not recommend it because they're on a certain medication?
None. I've not seen one reaction all across the board on anything. So.
Okay. Well, that's a good thing.
The only thing I know of is the shellfish allergy with the ATP, but you know, I'd be cautious about that. But we have.
I mean, with GXL.
Yeah, with the Max GXL.
Yeah.
Yeah, there's none of that with the Max 1. So.
Correct.
But even at that, in the shellfish allergy, we have had some patients that had shellfish allergies, and they tried it with no problem. So, but you know, again, is a contraindication though. But
Yeah, and I have seen that without a doubt, but it's very rare, and again, because of ribosine and Max 1,
Right.
you know, and no animal byproducts, it totally eliminates that.
yeah, but
that
since
issue.
the Max 1 came out, you know, there's none of that. So
Correct.
no worries there. So.
And we'd kind of mentioned before, you know, and just mentioned, in your opinion, any negatives that you've seen with the products at all?
The only one negative that I can see was with the Max GXL, patients with GERD, you know, acid reflux disease and stuff like that. Sometimes if they didn't take it with, you know, maybe a glass of milk or some food on their stomach, would give them a little bit of a heartburn, maybe some acid reflux, you know, things
Okay.
like that. But if that's the worst you're getting off of something that makes you feel that good, I can't really complain about that too much. But you know.
Well, now, again, as we just kind of alluded to a second ago, with Max 1, in those same patients, is that still an issue?
No, no, it's not. We just encourage patients to make sure they're eating something with it,
Okay.
and if you know they're not hungry or whatever the situation may be, you know, at least drink it with a glass of milk, you know, and that seems to be alleviating it in itself. So,
Okay.
and again, this Max One, you know, has come out, and I'm not seeing any problems with that. I've taken it on an empty stomach myself before, and nothing, no burping, funny taste,
Yeah.
no
Well, yeah.
gas, no heartburn.
Yeah, and I can understand that. I think ribosine does kind of
Yeah.
eliminate those aspect of things.
Absolutely.
So, in addition to increasing the glutathione levels better than GXL has,
Mm.
which was a phenomenal product. So, well, that's awesome. Well, listen, I appreciate your time very much and talking with us. And everybody, this has been Cody.